Doctor, I don't want anesthesia. It has a lot of side effects. Can this surgery be done without it? Now, imagine this. A patient needs to undergo a surgery to save his life. No anesthesia. He knows that he's about to experience an excruciating, soul-numbing pain like never before. He's heard stories of others who have gone through this pain. He's not so sure about coming back alive from this experience. His days are numbered, like a criminal awaiting execution. On the day of surgery, he is pulled to the operation theatre by strong men and placed on the table where the surgeon awaits with glistening instruments that are about to cut him. His only option now is to close his eyes and give in to the pain that is about to unleash. He can only scream so much. He can faint, a welcome relief, but only to regain consciousness and go through it all again. This is the real story of every surgery before the advent of modern anesthesia. Did patients just suffer? There were herbal compounds like opium-based medicines, mandrake juice, belladonna to offer some pain relief. But they had their dangers too. Too little meant there was still pain, and too much could kill the patient. Couldn't the patient not drink alcohol and just doze off on the table? The surgeon wanted the patient to be awake, to know if he was dead or alive. The surgeon also had to complete the surgery before the patient passed out from the shock of pain. So speed was an important skill to master. In fact, Dr. Robert Liston, a very eminent showman surgeon, holds the record for completing an amputation surgery within just 28 seconds. He was famously known to say, "All right, gentlemen, time me," before his every surgery. But was it safe? Best example is one of Robert Liston's surgery on a patient where his knife went too deep in the hurry and killed the patient, and also severed the finger of the man who restrained him, who later died of septicemia, a surgery with 200% mortality. Patients avoided surgery. They chose to live with deformities and cancerous growths. Only surface surgeries were possible. Speed was the only determinant of a successful surgeon. But things were about to change. In the mid-19th century, a compound called ether was used in parties of the rich for recreation. A medical scholar, Crawford Long, was invited to one such ether frolic party where he observed that men who were under the effect of ether did not feel the pain of falling down and sustaining injury. But Crawford did not publish on this till he was completely sure. History was made when William T.G. Morton, on October 16, 1846, successfully demonstrated the use of ether anesthesia for tooth extraction. A lot has happened over the years in the field that was born that day. Ether was extensively used. Surgeries could now slow down, could become more accurate, and move on to the forbidden areas of chest, abdomen, and the head. Thanks to the innovations in the field of drugs, instruments, monitoring equipments, imaging instruments, simulation training, today anesthesiologists are highly skilled professionals who offer a range of expertise not only in the operation theatre but also in emergency and trauma care, ICUs, pain management, resuscitation of cardiac arrest patients. Patient safety is our mantra. Mortality directly related to anesthesia is as rare as 1 in 2.5 lakhs. The field is so advanced in monitoring every possible parameter to keep the patient safe and comfortable during anesthesia. So next time you're worried about anesthesia during your operation, remember, we have given our time and life to care when you're not aware.